I think looking through the eyes of a cancer patient, community would mean everyone that is participating in their care, from their doctor, their nurse, the person at the front door, the pharmacist. And if you really think about it, cancer patients, they're in a fight. So it's everyone that's going to be in that fight with them. And community health workers are the key to the community. You can't get in the community without the community health workers. So everything is community engagement. That's it.
Welcome to the Cancering Show. We are in for a real treat this episode. You're going to meet Janel Lowman, who's a colleague of mine and absolutely one of my favorite people. We're going to talk about community outreach and engagement, which you'll find is a main theme for Season 3 of the Cancering Show. Janel holds a master's in health administration and has more than a decade of community outreach experience with the University of South Alabama. Her current role is Senior Manager Community Outreach at the USA Health Mitchell Cancer Institute. That means that she's the tip of the spear for engaging and communicating with our local community and all that that entails, whether we're talking cancer survivorship, cancer prevention, or even COVID prevention. Can you imagine what that was like during the pandemic? Well, we're going to talk to Janel about handling this massive disruption in normal operations, as well as what lessons she learned from the 2010 BP oil spill that applied to the pandemic and beyond. It's all about what it takes to become and be a community health hero. Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. Janel, we're so excited to have you on the podcast. Thanks so much for being here.
I'm excited to be here. I'm a little bit nervous, but I like to talk, so it'll all work out.
Oh, I know you're going to do great. There's so much. I am so excited to have you here. There's just so much that our cancering community could learn from you. I want people to know who you are and what you do. But before we get to that, I want you to take us back to early April 2020. The doors of the Mitchell Cancer Institute, for all intents and purposes, closed except to the people you let through the door, doing door-to-door screenings, and also in your spare time, finding other ways to take care of our cancer patients by going to their homes.
Yeah. Early April, when COVID was just front and centered and it was on the news, it was everywhere, it was a scary time. You know, it was scary for me in a sense of I wasn't sure what's going to happen with outreach because everything related to outreach was stopped. So I didn't know what to do, and the community was scared. Honestly, I was scared too. So the first thing they did was put me on the front door, making sure people that came into the building, they were not sick, they didn't have symptoms of COVID, and they were masked. And during that time, it's kind of funny when I look back at it, because during that time, we were in full PPE, meaning we had on masks and shields, and it was starting to get hot outside. So that was kind of hard. And then I had to figure out a way. Community outreach can't stop. You know, we have to keep it going. People need information, and they need information more now in the midst of this pandemic than ever. You know, we can't stop screenings. We can't stop this. So it started with giving out masks because that was one thing we knew that worked, you know, unrelated to cancer, but we knew masks worked. So it was a lady in a church, in a local church near me, that lived near me. She was making masks for her fellow breast cancer survivors. And I got with her, and we just started going in the community and handed out masks to people. And we got a chance to see, you know, some places we weren't really welcome. And I don't think it's because they didn't want the mask, but people didn't want to let people in their house or to their house. You know, they didn't know if it was in the air or, you know, they just didn't know. So that's where it started. That's where that kind of outreach started, with just handing out masks to neighbors.
And I am always amazed at the different ways that you in particular and all of our force of people who are experienced in community health and community engagement can find ways to connect with people. take us back. You have been in community engagement for over 10 years. You did not start in cancer. And, I just want people to know, and I said it in the intro, you are a nationally recognized expert in community engagement. People come to you to ask, how do we connect better with our communities? So talk to us about what kind of got you into this.
I'm going to tell my age with all of this, but it dates back, I think, probably to 2006. And the University of South Alabama had something called the Breath Mobile. And it was a mobile asthma clinic that ran around to the Mobile Public County schools, elementary, middle, and high schools. And we saw, treated, and took care of children with asthma. And we focused on those kids that were missing days from school, kids whose parents didn't have adequate transportation. And we were able to treat those children on site on this big RV that I drove. And
I did not know you drove the RV. That is a nugget.
I did drive I drove the RV
So
after
when we
one
get,
day of practice.
When we get the big mobile mammography / cervical cancer screening unit, you're going to be right there in the front.
I wear glasses now, so I don't know if that's going to happen. But yeah, that's what we did. And we were able to see that kids were making better grades. They were having less days out of school. Parents were able to not miss work. So it worked. And that's where I learned that sometimes you have to take the medicine to the community.
Absolutely. And then again with the BP oil spill, that was your next adventure.
Yeah, it was on campus. It was the USA Coastal Resource and Resiliency Center. And we recruited community health workers and employed them along the Gulf Coast in Alabama, Mississippi, Florida, and Louisiana.
And I think there's so much about not just being the only community outreach person, but connecting to other community health workers, teaching them what they need to know from a medical standpoint, but allowing them to work in their own communities. That's so powerful.
It was, and that was the thing that was missing. There were people that were diligently working in their communities, trying to improve the status of the communities, but up the street wasn't talking to down the street. And once we were able to pull all these people together in one room and they could hear what each other had to offer, it just brought a whole new level to social capital. It did.
You are speaking the language of the future, and yet it's something that we've known from the past. I think too often we are thinking about what does community mean? How do we bring people together? And it's this communication. I have to ask, but I want to see kind of, what do you feel like community means to you when we talk about a cancer patient?
I think for a cancer patient, community would mean, looking through the eyes of a cancer patient, would be everyone that is participating in their care. From their community would be their doctor, their nurse, the person at the front door, the pharmacist. And if you really think about it, cancer patients, they're in a fight. It's a fight. So it's everyone that's going to be in that fight with them. And
I think so much so in the building, but even more so the folks who are fighting with them at home.
Yes. And that kind of brings me back to something else. When COVID first started, my thought with cancer patients, I'm going to fight for you. I will educate you. But I often didn't want to go through the building because for me, I thought I was seeing sad faces and not always people that were full of hope. But once I was placed at the front door to make sure everybody came in the building wasn't sick with COVID, I got a chance to see that these patients were living with COVID. They were in the fight, and then it humbled me. It made me realize, I can fight for you guys. I can do it.
Yeah. Absolutely. Living in the COVID circumstances, living with cancer, and you're not a stranger to cancer in your family.
No.
I think about when you make decisions every day, it's not just you're making those decisions for.
Yeah. My mother, I call her my number one volunteer. Well, she lost her sister to breast cancer. So cancer is very familiar to me. Caregivers are close to my heart because without your caregiver, that's a huge support system. So, it's not a stranger to my house.
And, we think about the community surrounding our cancer patients and the fight that they need. And we've known for a long time that it takes community engagement, community health workers to encourage people to take a moment, take the time to get in and get screened for cancers, that mobile units do better in getting people screened for cancer. And I was fascinated to watch that same skill set be translated into COVID and COVID vaccination.
Yeah, if you want more community engagement, if you want more people to do what you need them to do, whether it's getting a vaccine, getting a screening, or whatever they need, you have to send people that are like them into that community to get it done. Because, when it was on TV and we're trying to encourage people to get vaccination, I was screaming, get community health workers, they'll do it. People are reluctant. People are not trusting. We have a climate now it's just not trusting to what we deem as authority. So it's getting those people in their communities to act as these ambassadors, people will listen.
Absolutely. And the number of people you have encouraged to wear a mask, to get vaccinated, to get screened for COVID if they have symptoms. I was fascinated to watch your skill set get put into full motion. Unfortunately, during the height of COVID, so much of what you did and do in community engagement, but also so many screening behaviors were put on hold or halted or delayed. And just to watch you flip and immediately say, this is the exact same skill set, and now I can use it for COVID behaviors.
Yeah, before COVID, we had something called the Alabama Hope Project. And that's where we paired cancer survivors with lay educators that we train to go in the community, encourage women, encourage people to have their cancer screenings. Well, when COVID happened, that just stopped. But we had to rethink it. And we were able to go virtual, not quite as effective, but it was still getting something done. And we had social media campaigns because everybody at that time was using social media because nobody was visiting anyone. So that's what we did. And we were able to revamp it. And now in the process of trying to really get that kicked off again.
Yeah, I am so excited about the Alabama Hope Project. It has been a passion project of mine to see you lead it and to bring that into fruition, and tell people how they can get involved and what all it entails.
Okay, you can get involved by going to the USA Mitchell Cancer Center website. We are hoping by the fall to have a meeting. You can email me. So the information would be left here somewhere.
Yeah, we'll make sure that information is on the Cancering Show website and Facebook page. Okay, everybody. That's a good place to take a break to talk about another community organization that we partner with for cancer patient and survivor support. The Ronald McDonald House Charities of Mobile provides a supportive home environment, offering care, compassion, and hope to families who have seriously ill and injured children who are being treated at area hospitals. The history of the Ronald McDonald House nationally and the Ronald McDonald House of Mobile are both the story of what one motivated, determined person can do. Nationally, that person was professional football player Fred Hill of the Philadelphia Eagles, whose daughter had leukemia. Hill asked his team's owner about helping families of hospitalized children, and together they approached McDonald's to build the first Ronald McDonald House in 1974 in Philadelphia. In Mobile, the person who started the house was Gray Zimlick, who had stayed at a Ronald McDonald House in Boston while her son, Day, received treatment for brain cancer. Day told his mother that Mobile needed a similar house, and she promised him she would make it happen. In February 2000, the Ronald McDonald House of Mobile welcomed its first family. Since then, the Mobile House has served almost 9,000 families as it continues to keep families close to each other and the care they need. For more information, visit rmhcmobile.org. So Janel is a community health worker and someone who trains community health workers. You go out into the community, you talk to groups of people. What's the most impactful place that you do that?
Okay, I have two. One is church, and the other one is small women groups. So when you go to churches, you are not just talking or presenting information to a certain demographic. You get the whole family. So you get all people of all ages. You usually get a lot of people at one time So, and people are listening, they're in church, they're on their best behavior. And the second one is women's groups. Women's groups tend to be intimate. It's, a smaller amount of women. We get a chance to talk a lot of one-on-one, and they always have good stories. And, and if there are cancer survivors there, they often like to share their story. And sometimes you just don't know how their story is impacting the person that's sitting next to them.
And I think that's really where the original idea behind the Alabama Hope Project came from, because you could see how much a survivor sharing their story really encouraged people to go and get screened.
Yeah, because no one can tell that story like a person that's already been there.
Absolutely. And women are the decision makers for the whole family. So they can make that decision for their husband to get a colonoscopy appointment and make the appointment for their child to get an HPV vaccine or whatever is the behavior that we are encouraging to make people live healthier, longer lives.
Absolutely.
Okay, Janel, let's imagine one of our listeners who has a heart for it, really deeply feels what you're describing, and maybe even has a cancer journey or a cancer story or a caregiver story themselves. Maybe somebody who's not medical at all, not connected to any type of health work. What would you say to that person about how to get involved and what the training might look like and what the work would be?
So if you have a heart for giving back, we have training modules that you would have to complete on your own time. Once you have completed those modules, then you would assist us in health fairs, in community talks. You never would be by yourself. We're always there with you. And it would be your way to give back and help your community.
And for those folks, what comprises their communities? Who do you encourage when you've trained a community health worker? Who do you encourage them to reach out to?
So once they have completed everything and it's their time to help, I encourage them to talk with their friends, their neighbors, their church members, their family, just anyone that you want to see live a healthy life.
So the last thing I want to ask you, and there's so much more we could talk about, but I do want to ask you, what do you think community engagement is going to look like now? We've been through this experience of learning all over again that even in a pandemic, you have to get out in the community. And yet we've also learned how much people need to be connected digitally and how you can reach more people digitally. What do you think it's going to look like now?
I think that's a great question. I believe that community engagement now is going to be learning how to live with COVID. I don't know if it's going to ever go away, but we can't stand still. And we can't let numbers continue to go up and people continue to miss appointments and miss screenings and everything related to cancer. So I think it's going to be just finding ways to live with it and to still be able to reach masses of people through social media and sometimes outdoor events and just being safe, things that we normally don't think about, like, okay, everybody's going to have to wear a mask or, having hand sanitizers at the stations and things like that. We're just going to have to make sure we make note of that.
Yeah, absolutely. And I think we're going to find that getting into the communities more mobile units, more mobile events, like you were saying, can really bring the screening to the patient rather than the other way around. I think people in some ways are wanting to be closer to home, to be treated closer to home, to have their doctor's visit and screening visit and even treatment closer to home. And I think that in the digital world, we should be able to accommodate that we should figure out a way. And the more community health workers that we have, I think the better we can overcome the larger challenges. You talked so much about the social capital, and I think that comes with a hope for equity and justice and overcoming, as you said, kind of the up street talking to the down street and bringing people together.
Yeah, community health workers are the key to the community. I mean, you can't get into the community without the community health workers. That's it.
Yeah. And that energy Every time I've been in a room of people who are excited to educate and bring their community together, it's just an incredible energy. It's like harnessing a tornado. You just want to send people out and let them do the good work.
You have to have a heart for it. It is a job, and you have certain check marks you have to do because you're employed. But your work that you do, it comes from your heart, just your desire, your passion to actually help people. So, you have to have a skill set, but you have to have that passion. And we work all the time, every day.
Right. It's so obvious in you. You can see it every day when we chat about something you've done for somebody else. But to me, it does always come back to, it's like, Janel, what are you doing? Oh, I'm, delivering some masks for people. And I was just blown away all over again.
Everything is community engagement.
The tornado was running through Mobile. All that energy. I love it.
Is that what you call it, a tornado?
Call it you or tornado of energy.
Yeah.
I love it. You're a powerful force.
Thank you.
Thank you so much for being on the podcast. We are so honored to have you and to hear all of your ideas for how to get more folks involved. And we hope we will have some volunteers for the Alabama Hope Project.
Yes. Thank you.
I just love how Janel has a passion for her job, profession, and community. She really has a gift for connecting with the people she meets, listening to folks, and being a voice for them when it's called for. What an inspirational story about how during COVID, she was the crucial connection between our cancering patients who are basically stuck at home and the outside world. What a blessing to all of our cancering patients and to our community. Janel, I can't wait to see what the future holds for you. Thank you for being here. For those of you out there interested in learning more about the Alabama Hope Project, we'll have information on our website. Remember, you can sign up whether you are a community member who wants to be part of the education or a cancer survivor who wants to inspire others for cancer prevention by sharing your story. And all of you out there, thanks again for listening. Be healthier, be happier, and remember, cancering affects us all.
Thanks everyone for listening to The Cancering Show with JYP, Dr. Jennifer Young-Pierce. Please subscribe, rate, and review this show on iTunes and anywhere else you listen to your favorite podcasts. Want us to deliver The Cancering Show to your email inbox? Contact us at cancering.com and we can make sure you never miss an episode. We would love to know what you think about the show or if you have any suggestions on topics you would like to hear. You can reach out to us on Facebook, Twitter, and cancering.com. Until next time, be healthy, happy, and always thriving.
This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond, with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.